So you have diabetes and you have questions? Well, I'm Jessica English, a registered nurse, and this is Just a Nurse Talks. In this video, we're going to be discussing diabetes and how it affects your body. But first, please hit the like and subscribe button to get notifications every time I release a new video. Diabetes, simply stated, is an imbalance of sugar inside your body. When referring to this sugar, I'll also be referring to glucose, i.e., blood glucose levels. The function of glucose is critical to the body. Inside a cell, it makes energy to allow that cell to function. So take, for instance, your brain cells. Your body takes 20% of your glucose and puts it inside your brain cells to allow you to think. So where does glucose come from? Well, there are foods that are high in carbohydrates, such as bread, rice, beans, and vegetables. These foods, when we eat them, are broken down into carbohydrate chains. These carbohydrate chains are also then broken down and turned into glucose inside our bloodstream, raising our blood glucose levels. This glucose then needs to go inside our cell. However, it can't just go inside, it needs help. That help comes from a hormone called insulin. Now, insulin is produced by our pancreas. Insulin has two main functions. First, it helps put glucose inside your cell. But second, it takes the remaining glucose that your cells don't need and it stores it for later use. Diabetes occurs inside your body for several reasons. One being not enough insulin produced by the pancreas. But two is an oversaturation of glucose. Originally, your body can handle this oversaturation. But over a time period, your cells become desensitized to the amount of glucose the body's been exposed to. We know an oversaturation of glucose occurs when we eat cakes, candies, and cookies. But you also realize that it occurs when you eat bread, rice, beans. These foods contain a type of carbohydrate chain that is broken down easily, leading to an increase in your blood sugar quickly. While there are other foods, such as carrots or broccoli, that have a more complex carbohydrate chain and take longer to break down. So what does this mean for your lifestyle? It means you need to rethink what carbohydrates you're eating. Here are some helpful tips to help you navigate this. Tip 1. Manage your protein to carbohydrate ratio. You do this by eating a majority of your carbohydrates first thing in the morning, and then for lunch, you're going to eat about half and half of your protein to carb, and then for dinner, you're going to eat mostly protein. Tip 2. Eat protein at night. Your body rebuilds itself when you sleep, and protein is needed to rebuild a cell. But if you eat carbohydrates at night, you're just going to store them to use later, causing weight gain. And tip 3, eat a protein when you eat a carbohydrate. It helps sustain your blood sugar for a longer period of time. Thank you for watching. I hope you found this video informative and helpful. If so, please hit the like and subscribe button down below. It'll help me bring more content to you. And if you have any questions, please leave them in the comments below. I will try to answer them as best as I can. This is Jessica English, a registered nurse with Just a Nurse Talk.